Okay, we're going to talk for just a few minutes about activated charcoal. Some of the common trade names you might encounter is Actidose, Liquid Char, or Easy Char. Activated charcoal isn't used quite as much as it used to be, I think, but it is an antidote and an adsorbent. The way it works, the mechanism of action is going to be it adsorbs toxic substances from the GI tract. So this is something that we take orally, drink it down. I've heard it tastes terrible. A lot of times they'll mix it with a sweetener like sorbitol, and then it binds with whatever that toxic substance is and causes it to become inactive, and then you excrete it out via fecal matter. It is pregnancy class C, so overall not too bad. Indications for giving activated charcoal. It's going to be oral poisonings and medication overdoses. Some contraindications for it. We'll kind of get more specific on the indications here in a little bit. Contraindications is going to be a comatose patient, someone who is unable to swallow and maintain their own airway. You do not want to aspirate this stuff. Another contraindication is going to be ingestion of corrosives, caustics, and petroleum distillates like gasoline, stuff like that. Use caution with patients with GI obstruction or abdominal pain that you're not sure what's causing that abdominal pain. Adverse reactions, like I mentioned, don't want to aspirate it. It will kill you quickly if you aspirate activated charcoal. Cause pneumonia, bad stuff. So make sure that these patients are able to drink it very well. It can also cause some constipation, black stools, diarrhea, bowel obstruction. Not quite so serious. And from what I've heard, it tastes bad, so it could cause some vomiting as well. Some drug interactions that we need to be familiar with. It bonds with and deactivates most other meds that we give orally, including syrup of ipecac. So if you're giving syrup of ipecac to try to get someone to vomit up whatever they might have taken, then activated charcoal will deactivate that. It will not absorb arsenic, cyanide, iron, lead, or lithium. Keep in mind. The dosage for adults and kids is the same. It's going to be 1 to 2 grams per kilogram via PO, which is taking it orally, or you can put it down in NG tube. I would be very cautious with doing it in NG tube unless that is confirmed that is in the gut, not in the lungs. If you can, be very cautious with that unless you don't want to get it in the lungs. A duration and of effects, it's pretty immediate. It stays in the system, depends on how long or how well your GI tract is working, and then you're going to poop it out whenever it's done. It's often used with magnesium citrate. They kind of potentiate each other. So here's a nice list, and you can find this on Google, but stuff that doesn't absorb very good: cyanide, ethanol, ethylene glycol, which is antifreeze, iron, isopropanol, lithium, methanol, and then strong mineral acids and alkali. But stuff that it does absorb pretty well, adsorb. It's a nice big list there: amphetamines, antihistamines, NSAIDs, quinidine. Lots of medications that it's very effective for. So you don't want to just start giving this to everybody who's overdosed. But if they do have any of these medications that they might have overdosed on, or you think they need it, then there you go. That's kind of the basics for activated charcoal.